Okay, so this story is, well, it's pretty unsettling, but it's also absolutely fascinating. We're going to dive into a parasite that has a particularly chilling way of making itself known. Just imagine for a second, you go to the doctor and this is what you tell them. It's not, a headache or a stomach ache. You're telling them you can see something moving. This was the actual reality for a 64-year-old woman from the Democratic Republic of Congo.
And look at this. This is literally what she saw. What you're looking at right there is a live adult worm just migrating across the surface of her eye. I mean, wow. It's so visceral, right? And yes, this thing has a name.
So, what in the world is this thing? Let's meet the culprit, the African eyeworm.
All right, the official medical name for this is Loaloa. It's an infection you get from a parasitic worm called Loaloa. And yeah, as you can probably guess from its nickname, its most famous, or maybe I should say infamous, symptom has to do with the eye.
So, how do doctors know for sure that this is what they're dealing with? Well, what's really interesting is that there are two classic telltale signs. They're what doctors call pathognomonic, which is just a fancy way of saying, if you see this, you've got your answer. The first one is pretty obvious, the visible worm in the eye. But the second one is something called a calabar swelling. These are these weird, itchy, temporary swellings under the skin. They just kind of pop up, usually near your joints, and then they disappear.
Okay, but the big question is, how does a worm even get into someone's eye? I mean, really. To get that, we've got to look at its life cycle, which is, well, it's pretty complex and honestly kind of sneaky. So this here shows you the whole journey from start to finish. You can see right away that this parasite, Loaloa, it can't survive by itself. It's totally dependent on two other players to complete its life cycle, a particular kind of fly and, you guessed it, a human. So let's break this down. Okay, so it all kicks off with a fly, specifically one from the Chrysops genus. This fly, which bites during the day, takes a blood meal from someone who's already infected. In that blood, it sucks up these teeny tiny baby worms. They're called microfilaria. Now, inside the fly, these little guys spend the next week or so growing up, maturing into what are called infective larvae. And then, they make their way up to the fly's mouth, just waiting for their chance. So, the fly bites another person, and bam, those larvae slip right into the bite wound. Once they're inside you, they finish growing into adult worms, and they set up shop in the tissue right under your skin. And these adults, get this, they can grow up to 70 millimeters long. They can live for years just hanging out, mating, and producing thousands of new microfilariae every single day. And all those new baby worms, they start circulating in the blood, just waiting for the next fly to come along and start the whole crazy cycle over again. All right, so we've seen the parasite up close and we get its life cycle. Now let's pull back a bit and look at the big picture. Where in the world is this actually a major problem? Before I even show you the map, I want you to just think about this number, 14.4 million. That's how many people are estimated to live in high-risk areas for this infection. So yeah, this is not some super rare isolated thing. Not at all. And here's the map. This shows us exactly where that risk is focused. You can see the infection is endemic, meaning it's constantly present all across the rainforest and savanna regions of Central and West Africa. And those dark red spots? Those are what scientists call hyperendemic regions. In some of those places, the prevalence can be over 40%. That's staggering. So who's getting this the most? Well, it's mainly people living in these 11 countries, with the DRC and Cameroon being hit the hardest. We also see that it's often more common in men, and that's probably because of their jobs, things like farming or working in forests where the flies live. And as you'd expect, your risk goes up the older you get, just from a lifetime of being exposed to more and more bites. Okay, so we know who's at risk, but treating them, that's a whole other ballgame. It turns out that fighting this parasite is, well, it's incredibly tricky, and it can even be dangerous. You see, it's all about this really dangerous balancing act. If a patient has a pretty low number of those baby worms in their blood, we're talking fewer than 8,000 per milliliter, doctors can use a drug called DEC to treat them. But, and this is a huge but, if that person has a really high parasite load, giving them that same drug is incredibly risky. It can cause all the worms to die off at once, triggering this massive, severe reaction in the body that can lead to neurological damage or even a fatal swelling of the brain. It's terrifying. So, to deal with this, doctors basically have 3 tools in their toolbox. For those low-load cases, DEC is the drug of choice. But for the high-load, risky cases, they have to be more careful. They'll start with a different drug, albendazole, to kind of slowly and gently bring the number of worms down to a safer level. Then they can use the DEC. And of course, for that really obvious symptom, the worm in the eye, there's the most direct approach you can imagine. They just take it out. And this shows you just how that's done. I mean, it's an incredibly delicate procedure. First, they numb the eye with drops. Then the surgeon has to work really fast. They use forceps to basically pin the worm in place right through the top layer of the eye so it can't get away. Then a tiny little cut is made, a second pair of forceps goes in, grabs the worm, and pulls it out. And yes, it's still alive when it comes out. So yeah, with treatments that are this complicated and risky, prevention is obviously a much better idea, right? But that's where things get really challenging too. Because this whole thing is spread by a fly, prevention really boils down to just not getting bitten. That means trying to avoid places where the flies hang out, wearing long sleeves, using bug spray with DEET, putting screens on your house. All things that sound simple enough. But just think about how hard that would be to do every single day if you live in one of these rural, high-risk areas. And here's the real kicker. There's just no silver bullet here. There's no vaccine to prevent Loaloa, and trying to control the flies on a massive scale, well, because they breed in these muddy, hard-to-reach forest areas, it's been described as notoriously difficult. Basically, it's next to impossible. Which leaves us with a really tough question, doesn't it? If the treatment is dangerous, and we can't really do large-scale prevention, the entire burden just falls back on individuals. So what's the answer? What new ideas can we come up with to protect the millions of people who are living with the very real risk of one day looking in the mirror and seeing this?